I'm just going to do a quick introduction. So thank you, everybody. This is the premiere episode of Jobber Influencers with David, Chou, and Steve Aylward, and they're talking about virtual care, wearables, mHealth today. So I'm going to turn it over to them, and they're going to chat for about 15 minutes, and then we'll take a couple questions at the end, and we'll just have some fun. I turn it over to you guys.
Thank you. Thank you, guys. And thanks, everyone. Great event that we're piloting, that we're putting together. Steve Aylward, who's sort of a renowned figurehead in the healthcare verticals, who I followed greatly on social scene. And, you know, I have him here today just to have a really where we're headed in the vertical, whether it's virtual healthcare, telemedicine. That's really where I think the space is moving towards. So with that being said, I want an introduction, then we'll get started with a quick chat, and then hopefully have some time for some Q&A.
Terrific.
Yeah, so Steve, just tell me more, you know, give us a little about your background, some of the things that you have seen, your, you know, where you think the industry is headed.
Yeah, I thought what I'd do is just kind of give a flavor of what's driving, and you and I were just talking about this, David, right before you jumped on the line, that the explosion in virtual care and wearables and mobile health is really being driven, by my view, by natural market conditions. And it's almost, you could argue, it's the first time in the 20-plus years I've been in the healthcare IT industry where the market demands have kind of created this phenomenon, as opposed to regulatory demands, the things that we're most recently familiar with, like EMR adoption that was spurred by the High-Tech Act and continues to be funded to a degree by meaningful use. When you contrast that with what's happening in the whole telehealth, telemedicine, virtual care space, it's really being driven by a number of kind of basic factors, most of them economic, but it's probably worthwhile to kind of take a step back and look at those a little bit. But I thought that's what I do, just in terms of setting up what's driving the demand for virtual care and wearables and mobile health. Does that make sense, David?
Do you think that moving towards this virtual model with the wearables, the sensors, mobiles, do you see that more as a fad?
Oh no, I think it's the
or the industry is going to be headed towards and.
Yeah, I don't think it's a fad at all. I think that the market conditions are driving us all in that direction for a couple basic reasons. And if I just kind of dive back into that, when you look at all the avenues that exist now for consumers to engage in their care, most of those didn't exist. You don't even have to go back as 5 years ago. But when you think of all of the web-based portals that patients can now get access to, if not their entire medical record, certainly lab results and the like, that's a fairly recent phenomenon. But when you combine that with apps that are available on cell phones and other devices that are all increasingly connected to the internet, all of that wave of consumerism is driving this this movement towards virtual care. But the other thing that really doesn't get enough attention, and you and I were talking a little bit about this last week, is the fact that we've got an incredible shortage of physicians, not only today, but increasingly over the next couple of years as the physician population ages today, or as it ages. We've got physicians retiring and not enough new physicians coming in to replace them, and not enough new physicians to meet the demand of care. I think one of the stunning statistics that I saw the other day is that you've got 8 million people turn 65 and thus become eligible for Medicare every single day. So you've got this enormous wave of an aging population that's going to need more access to health care, and there aren't enough physicians and other types of clinicians available to deliver it. So with that as kind of a basic premise, you've got more demand than there is capacity, and that's going to drive the opportunity for emerging technologies like telehealth and other forms of virtual care to begin to take root.
So one of the things I've noticed, or I've seen talking to other clinicians, I've hearing lots of skepticism, which is a little bit surprising to me. I mean, I've always thought these were maybe a generation gap, but now when I see grandparents who are able to use technology to Skype, Facebook with their kids, I really don't see technology as being a true barrier. But there's a few physicians who are on the younger side who are a little bit reluctant. Have you seen that in your world? And what are some of the things that you have um, been able to do to tackle that sort of perception? Because for some reason, I still have lots of docs who love to have that physical one-on-one FaceTime versus leveraging technology that's out there.
Yeah, I think it's a very real issue, and if there was a really interesting article that was on the back page, I'm pretty sure it was on the money section. I should have pulled it out in today's USA Today, but it talked about the challenges, even not including virtual health, but just in EMR adoption. And you've still got a very large faction of physicians that feel that having the EMR, the electronic medical record, is a great thing, but they're spending too much time documenting information in the electronic medical record, which is taking time away from them to directly relate to working with the patient. And the fear is, I think, on the part of a lot of clinicians, that we wrapped up getting too into the technology, and that's taking us farther away from the patient rather than being closer, which is the intent of it. But that being one issue, the other issue is just from a technology perspective, and you just use today's example as a challenge. When we started the call, one little glitch, and clearly we've everything's working fine now, but at the start of a call there was some little technology glitch there that prevented me from hearing you, and likely the other way around. We haven't perfected the system yet so that it can be completely seamless to address that. So I think that's certainly creating some fear, uncertainty, and doubt with some physicians. But by and large, I think what we're seeing is an overwhelming movement on not just the health systems and the physicians that participate in those health systems, but you've got really three, if not four other factors that are contributing to that. You've got a significant number of private health insurers are now offering to subsidize and reimburse for all sorts of telehealth visits. You've got, at least to start with, major employers offering telehealth as a benefit to their employee population, and you've got consumers who, in the millions, have downloaded apps on their cell phone to be able to connect to a physician for somewhere in the order of magnitude of $40 a visit, and they'll either pay that out of their pocket gladly, or they're even happier if their health plan or their employer will subsidize the copay on it, as an example. So those other areas outside of the health system, and there's plenty of other competition and reasons for adoption amongst health system participants, but you've got a whole nother wave of areas which are driving this move towards virtual care.
Yeah, well, I love how you were mentioning the technology failure, because believe it or not, I'm actually using my mobile phone right now to do this video just because my laptop had to freeze. So, thank goodness for these mobile. I'm a big believer in mobile. I really think that's going to be the wave of the future. Some folks like to say, moving to the future, you can be able to have a doctor in your pocket just by having a mobile device.
That's exactly right. And you're seeing, I know, in the case of the electronic medical record you use at University of Mississippi, I know organizations are looking to their EMR vendors to increasingly integrate this technology, and I think that's one of the other issues that's causing that the relatively slow adoption by physicians, or at least the reluctance, let's say, for the physicians to adopt that technology, because they're doing everything in the EMR. They don't want to have to go to a completely standalone system or another EMR that might be virtually enabled to provide that care for their patients. They want to do it all within their system. So I think increasingly that's one of the trends that we're going to see, is the EMR companies beginning to, and some have already done it, begin to integrate some of this technology right into their platform.
Right. And then, so what's your opinion on the future after EMR? Do you think there's going to be a third platform? Do you think we're all going to be developing on top of the EMR, and they may or they're going to start eventually getting that world of virtual care and having that battle with the retail clinics that we see that's coming up pretty strong these days.
Yeah, I think it's a very viable solution or an alternative to what's happening with retail care. And if you look at, depending on the geography that you live in, you're going to see your local retail pharmacy providing, increasingly if they don't already, providing a physician or at least a nurse practitioner or a physician's assistant, some level of licensed clinician to be able to provide care in that local setting. And what that's doing is it's bleeding patients out of the acute care centers and certainly their emergency departments towards those retail clinics. But what's interesting is if the retail clinics, depending on their location, if they don't have a clinician on site, they're increasingly looking to adopt telehealth using kind of think of a kiosk that's secure and private, that they could then connect right there in the pharmacy to a licensed physician who's licensed to practice in that particular state. So you're going to see this kind of dichotomy, this competition of retail very aggressively moving in this space, and then probably the health systems, all but the most advanced few, kind of moving a little bit more slowly. But the consumers are going to dictate where and when they receive their care, and I think that's been the biggest change. And with the kind of where I started my earlier commentary, with all of us as consumers now bearing a higher brunt of the cost of care, whether it's through what we pay out of pocket to pay for our employer sponsor insurance or through a higher deductible and higher copays. If I can go see a physician today for my, let's say sinusitis, I probably get a sinus infection every 2 years or once every 2 years. I don't want to have to go to my physician's office when I feel miserable to go sit in an office with any number of sick patients who have who knows what other illness. If I can just download an app on my phone and for $40 see a visit and have a prescription sent electronically to my local retail pharmacy, I'm going to choose that option. And people will be voting with their, I was going to say vote with their feet, but they're going to vote with their apps to more and more to receive that kind of care.
Perfect. Yeah, I think we're all agreement to that. Apps is going to be driving the industry more so than what people are going to believe. It's going to be more of a mobile apps world as we move towards that journey. The consumer is going to drive the demand. So, great stuff, Steve. We could talk about this for days. So,
we can.
One last question. 30 seconds. What do you think is going to happen in the next frontier? The big disruption that you see?
Yeah, I think it's going to be this movement towards, maybe take a step back and just say, when you think of how telehealth is being leveraged today, it's largely for things like I just mentioned with sinusitis or a bronchitis or conjunctivitis, something that's relatively mundane that only happens for most healthy people once, twice a year. And that model, given the infrastructure that's being brought to the market by a number of companies, probably isn't very sustainable to build hugely successful, fast-growing, scalable businesses. What we're going to see is the adoption of telehealth towards the more effective management of chronic diseases. And you and I were talking about this the other day, that today if you looked at roughly 6 chronic diseases, those 6 chronic diseases represent 75% of the healthcare cost in the United States. And those are people that have incurable situations, whether it's things like arthritis or asthma or congestive heart failure, forms of cancer, all of those things altogether, obesity, let's include that in there. But those require very frequent, if not weekly, oftentimes monthly, types of visits. So the opportunity for telehealth to address the incredible need to help those patients better manage their care, not only when they need to see a physician, but just as they track, and I didn't mention diabetes. Diabetes is another one where it requires regular monitoring and follow-up, and you need to do that at home. When you're out and about, you can use your app to download it. So I think you're going to see this kind of twofold to really address your question, David. It's this migration of away from the kind of cold and flu type of thing that telehealth is being used for now, but really providing a scalable, accessible, and affordable means to better manage chronic diseases. And then you're going to see all of these components, the wearables to track that information from your phone or from a device, being not only integrated in the telehealth platform, but ultimately into the EMR. So you can share that then with not only your physician, but likely a care team. Think of a patient-centered medical home or in an accountable care structure, a group of folks who would then have access to your health information and then can interact virtually just like we are on this call.
Mm-hmm. Great stuff, Steve. Appreciate your time. That's all we have today, folks, at Jobber Tech. And then I'll make sure my technology works a little better next time around. But appreciate your time. Make sure stay in touch, and I'll be following you throughout the social scene. Thanks again, Steve.
Hey, thanks, David. Thanks, everybody.
Okay.